So let's talk about direct contracting just for a moment, because it's a critical part of where ACOs are going. There are 3 new models. They started their implementation period in October. They are going live with their first performance year on April 1st. There are 51 signed up for the implementation period. I believe there's an out clause, so if they get to the end of the implementation and they think, oh wow, we're not ready for this, they could decide to defer and not participate in the first year, but expecting about 51 groups to be doing this. Some are standard, which that type of ACO is geared for someone who has risk, has taken on risk, is comfortable with risk. They're starting with a minimum of 5,000 beneficiaries in their model. The new entrants are for just that, people who've not taken on risk before. And so these are separate legal entities that are being formed in order to manage a patient population. And the ones that are coming in the new entrants are actually really interesting. And I expect to see more interesting ways of managing care outside the standard medical practice or health system as the new entrants into this DCEs. In fact, I believe there may even be a couple of post-acute care organizations that are either considering or are participating in this first year as direct contracting entities themselves. And then there's the high needs entrants, which are very specific diagnoses and medical needs that are a much smaller population of very, very sick individuals. Folks who have a lot of experience taking on very sick populations are looking at that high needs, that type of DCE. And then there's a couple more they've announced but haven't really launched. One is the geographic DCE, and that is based on a geography. And then we have the Medicaid MCO-based DCEs that'll start next year. And that program's interesting because it's getting into the Medicaid space. I think this is one of the first like Medicaid, risk-based type programs that to the scale that they're doing with this population. So it's going to be interesting to see how that comes out.